Hello, everyone, and thank you all for joining us on today's webinar on coordinated entry, what domestic and sexual violence programs need to know. I'm Debbie Fox. I'm the housing specialist at the National Network to End Domestic Violence, and I'm joined here by my partners with the DV and Housing Technical Assistance Consortium and also partners with US ICH and HUD. So our Housing Consortium, we've been receiving many technical assistance requests about how victim service providers can create effective, coordinated entry policies and procedures by the January 2018 deadline. We hope this webinar will help you along with that process. Joining me on the call as presenters are Larissa Kaufman from the National Alliance for Safe Housing, Emily Reamer from Collaborative Solutions, Abby Miller from the HUD SNAPS office, and Britt Manzo from the U.S. Interagency Council on Homelessness. They will tell you more about their work and prospective organizations during their training portions of the webinar. Larissa Kaufman from NASH will begin the webinar by providing more information about the DV and Housing Technical Assistance Consortium and highlighting the objectives of today's webinar and by providing an overview of coordinated entry. Larissa?
HHS, TIPSA, and the Office of Violence Against Women and Office of Victims of Crime under DOJ. And essentially, when they formed, that was 2015, they brought on 4 technical assistance providers to provide support around this intersection of domestic violence, sexual assault, and housing and homelessness. And the technical assistance providers are the National Alliance for Safe Housing, the National Network to End Domestic Violence, the National Resource Center Against Domestic Violence, and also Collaborative Solutions. And so just a little bit of information about NASH. So we are a project of the District Alliance for Safe Housing, and we formed primarily to focus on this issue. So we provide technical assistance to both the DVSA and also homeless and housing fields on a range of different issues. And focusing on homelessness and housing so that ultimately survivors and their children can avoid homelessness as the only means of living free. I can hear several folks for some odd reason on the line. So if you are not muted, please make sure that you mute yourself. So I'm guessing if I can hear you, we can all hear you. Pretty good. How's it going with you? What you doing? Heading home? Okay, sit tight while we handle the tech issue. Okay. Yeah, no. Yeah, let me see. Those of you who are, I can still hear you. Okay, now I think everyone else is muted except me. Okay, can everyone hear me? If you cannot hear me, put something in the chat box. I think we have the issue handled. All right, bear with us, Friday tech issues. I'm going to keep going ahead. So the other 3 technical assistance partners are Collaborative Solutions, National Network to End Domestic Violence, and NRCDV. Collaborative Solutions works in partnership for the empowerment of human service organizations and communities in order to positively impact special needs populations. NNEDV is a social change organization dedicated to creating social, political, and economic environments where violence against women is no longer exists. And the National Resource Center to End Domestic Violence. Part of the broader social change movement to end gender-based violence, NRCDV strengthens and transforms efforts to end domestic violence. So as part of our work with the Domestic Violence and Housing Technical Assistance Consortium, we identified a major need hearing from all of you in the field, and that was a clearinghouse of information on these issues in one place. And that is what we did. We developed a website called the Safe Housing Partnerships. It's safehousingpartnerships.org. You can see the URL here on this slide. And it provides a lot of information for all of you in the field, resources, anything from questions around what is rapid rehousing to how can I get technical assistance, what is the HUD rule, a range of different questions that you all had with a lot of different answers on the Safe Housing Partnerships website. So if you have not checked it out, please do. And we'll repeat this at the end of the webinar today, but if you have questions after the webinar, you can go to safehousingpartnerships.org and make a technical assistance request through the site. We'll also have all of our information loaded, and you'll be able to contact us individually as well. Okay, now we can get into it. So the objectives for today. We're going to review the federal requirements for coordinated entry related to serving domestic violence and sexual assault survivors. We will review different types of coordinated entry, including parallel domestic violence coordinated entry. We're going to discuss how to ensure safety and confidentiality for survivors accessing the homeless system's coordinated entry. We are going to share resources for domestic violence providers, advocates, and also for homeless providers. We're going to provide an opportunity to hear from USAGE and HUD regarding how communities implement federal requirements. I also want to add that our webinar today is largely based on an FAQ that we released a couple of months ago that can be found on the Safe Housing Partnerships website, specifically focused on questions that we have been receiving from domestic violence and sexual assault providers regarding coordinated entry. And so you can access that FAQ by going to safehousingpartnerships.org, and we are going to be bringing that FAQ to life today. And I just want to say that we are really thrilled to have USAGE and HUD participating in this webinar. So we are going to move ahead, and I'm going to actually pass this over to Britt from USAGE.
Thanks so much. Again, my name is Brittany Manzo. I'm our policy advisor here at the U.S. Interagency Council on Homelessness. Real quick, for those who may not be familiar, we are a small federal agency that coordinates and leads the federal response to prevent, end, and address homelessness by working across federal agencies to drive progress and align policy while partnering with states and local communities to understand what's working and not working. We work across federal partners, like I said, so that includes Health and Human Services, HUD, the Department of Justice, a lot of your funders, and 16 other federal agencies. So that's where I sit. Can I give us a second to maybe mute that line? Okay, thanks. So I'm going to start by answering the big framing question. What is coordinated entry? Coordinated entry systems, or processes, are designed to be the entry points into local housing crisis response systems. They're designed to improve local collaborative efforts to end homelessness for all households and to ensure that future homelessness is rare, brief, and non-recurring. Coordinated entry is accessed in different ways in each community, but each community is required by HUD, each continuum of care is required by HUD to implement coordinated entry so that assistance can be easily accessible and allocated effectively. Coordinated entry is designed to ensure that three things are happening. First, that all people experiencing homelessness have fair and equal access to the community's housing and homeless assistance resources. Second, that assistance is allocated as effectively as possible. And third, that assistance is accessible no matter where or how people present to request assistance. We know that most communities lack the resources needed to meet all of the needs of people experiencing homelessness or housing instability. Historically, people face long wait times to receive assistance. Coordinated entry processes help communities prioritize assistance based on vulnerability and individual severity of needs to ensure that people who need assistance the most can receive it in a timely manner. Coordinated entry processes also provide information to community leaders about service needs and gaps in their system so that they can help plan assistance and identify needed resources. I also want to mention that beyond housing supports, coordinated entry is also the point at which individuals and families can be connected to supportive services, such as those offered by local victim service providers or other programs and services that people experiencing homelessness might be eligible for, such as TANF cash assistance, supplemental security income, or social security disability insurance, and so on. USICH recently published a brief on how other systems and programs, including victim service providers, can plug into coordinated entry processes and enhance their partnerships with homeless service programs. I'll add a link to that in the chat box for you. So this slide walks through the core elements of coordinated entry and what it might look like from an individual's perspective. The 4 core elements are access, which is the engagement point for people experiencing a housing crisis. And upon initial access, providers associated with coordinated entry will begin assessing the person's housing needs, preferences, and their vulnerability. This process is called assessment. During assessment, the person's needs and level of vulnerability may be documented for the purpose of determining prioritization to ensure that people with the greatest need, as I mentioned earlier, and vulnerability receive the supports they need to resolve their housing crisis. The final element is referral. People are referred to available housing resources and other services in accordance with the COC's documented prioritization guidelines. So this is, again, what it might look like at an individual level. Now, this is going to look different from community to community. I'm going to hand it over to Abby at HUD to talk a little bit about how communities are implementing coordinated entry. Over to you, Abby.
Can you hear me? Can you just confirm, Britt, that you can hear me?
I can.
Okay, great. Thank you so much for having me. So I'm here representing HUD's Office of Special Needs Assistance Programs, which we affectionately refer to as SNAPS. And the SNAPS office administers the Continuum of Care and Emergency Solution Grant programs. So for those of you who receive either of those funding pools, I'm sure you're very familiar. For those of you who don't, you've probably had to work with the projects who get our money or the continuums of care. So as that office, we play a pretty unique role and hopefully one that is driving really important local change. We work with USICH and our other federal partners like OVW and FIPSA and many others to set goals and policies that we believe are the keys to ending homelessness. And we've partnered with USICH on the federal strategic plan to end homelessness and really try to take an approach of using data to drive our decisions and our policies and our goals to get to an end. So as part of that, we have traditionally in communities, individual projects have operated as individual projects. They've had their own wait lists, they've had their own intake process, their own eligibility criteria that they decide on above, of course, what's expected as the result of receiving different grants and funding. But what HUD and the SNAPS office in particular has been trying to work towards in this goal to end homelessness is really to get at thinking as a system rather than thinking as individual projects. And we're taking a number of approaches to that, but the one we're talking about today, coordinated entry, I think it's really important to think about it in the context of system thinking and system planning, because that's really the intention behind it. So just to set that framework for you. And coordinated entry is very much about taking all of those individual projects across a community and engaging in a mutual decision-making process to determine what you as a community believe are your priorities. Who do you think is most vulnerable or most in need of housing and services to resolve their homelessness? And that is really at the core of coordinated entry. So I'm going to talk about the requirements and compliance deadlines and all of that, but it's all in the context of this intention to move towards acting as a system, being able to think as a broader community. So we established back in January of this year, of 2017, we established a coordinated entry notice, and that was a whole slew of requirements that we established for continuums of care to establish and operate a coordinated entry process. Continuum of care and emergency solution grant recipients and subrecipients are required to use coordinated entry. That means that depending on their role in the system, they may be providing referrals or receiving referrals, sitting at the decision-making table, the planning table. They may have a variety of roles, but they are required to participate. And in addition to that requirement, we strongly encourage the continuum to engage broader projects that aren't covered by our grant programs but play such a key role in ending homelessness. So as part of the requirements that we established in that notice, which I believe we can put a link in the chat box here for those of you who haven't pored over it with a fine-tooth comb already. But the coordinated entry process must include confidentiality and safety protocols to address the needs and safety needs of those who identify as survivors. It's a very key part of the requirements and one that I very much hope that the continuums that you all operate within or in conjunction with or parallel to, that you've been engaged by them in thinking through that. So the compliance deadline for continuums of care to at least be able to demonstrate that they've met the requirements in the notice is January 23rd, 2018. It's not like something magical happens on January 23rd, 2018 and something turns on and suddenly everybody can prove compliance, but it is a compliance deadline that people are trying to move towards to be able to demonstrate that they have their policies and procedures in place that meet the requirements throughout that notice, including the one that I've highlighted here, which is having confidentiality and safety protocols in place for survivors. So the SNAPS office and our technical assistance providers have produced a few materials that are meant to help people implement. We put out a coordinated entry core elements guidebook, and so Britt was just talking about the phases of access, assessment, prioritization, and referral. The guidebook has a chapter dedicated to each of those to kind of go into more of the planning decisions and also to describe what we mean, because we're really kind of making this up. You know, what an access point means, we need to be able to define that. What an assessment means, we need to be able to define that. So that guidebook definitely gets at more of that. And then we also produced a self-assessment that our TA providers are working with continuums on that essentially breaks down each of the requirements in the notice. Notice language is not particularly easy to read or fun, and so we wanted to provide a self-assessment tool where you could see each individual requirement laid out in a kind of checkbox format so that continuums of care are crystal clear on what they have to have in place for that compliance deadline. So then going to the next slide, there's one area that I want in particular to focus on for you all from the coordinated entry notice. So this idea of a coordinated entry process being a system level, operating to flag to provide access, first of all, to everybody in a standardized fashion so that there are not people who have historically been marginalized and kept out of the system, that they're not being kept out of the system anymore. But then we've allowed for a couple variations in the coordinated entry process. It is very important to open up access to everybody, but we also understand that it's important to account for the differences in vulnerabilities, the difference in somebody's needs when they show up to an access point or call into an access point. And so we've allowed for a variation in the notice for different, what we refer to as subpopulations. I will admit I don't love that term, but it's essentially adults without children, adults that are accompanied by children, which we'd usually refer to as families with children, unaccompanied youth, and households fleeing domestic violence. And the reason why we have allowed for different access points is that these four groups of people characterized by this particular characteristic that we have here is very much about adults and families often go into different parts of the homeless system. They have different resources available to them and may have very different vulnerabilities or service needs. And so it looks different of how we would want to provide access and how we would want to do a standardized assessment of everybody who kind of fits that characteristic. And households fleeing domestic violence, we believe very much that there are vulnerabilities and service needs that are potentially different enough for households fleeing domestic violence that it may make sense to have different access points and a different standardized assessment for people. Now, I want to be clear that these different access points and assessments are allowed. They are not required to be different. And so the discussions that you hopefully have been engaged in your communities or your counterparts have been engaged in is about making that decision. Do we need different access points? If we do, why do we need them? And to go back to the earlier point, it's quite likely because of the confidentiality and safety protocols that you have in place. It affords a certain level of control to make sure those protocols are in place. So those are the areas I want to touch on, but I look forward to seeing questions in the chat box. I can try to respond in there, and we'll pass it back.
Thanks so much, Abby and Britt. And Debbie, you're on.
Great. Thanks, Larissa, and thanks, Abby. So I'm going to talk go a little bit more in depth about opportunities for domestic and sexual violence survivors and providers in the coordinated entry process, the benefits of coordinating services and coordinating housing resources for our population. So, you know, it's really key that domestic and sexual violence providers are essential partners in their continuum of care processes, and they can play a significant role in informing local coordinated entry processes. So as full partners in their community's coordinated entry process, providers can help ensure that survivors have a voice at the table and can share information on the housing barriers and challenges that face survivors, as well as the confidentiality and safety needs of survivors. So as a part of coordinated entry, you can increase survivor access to communities' full range of housing supports and resources. If DV survivors are coming into the victim service provider system, that's only one range of services, of housing services. So by coordinating services, they're able to access resources across systems and be referred into and get access to those resources. And it's really important in local communities and with balances in state that you're working in community and responding to addressing homelessness, because it's something that affects our entire communities and impacts us all. It's really key for us to have those relationships across systems and build collaborations with homeless organizations, as there are many shared values, and we are stronger working together. And then it's also important that we influence our critical policy decisions that impact people experiencing homelessness and domestic and sexual violence survivors. And then it's just really important, and I've seen the benefits of having survivor voices at the table, because they can really talk about the unique housing challenges faced by survivors, along with victim service providers at the table. Also, there's opportunities to do cross-system learning and collaboration, so educating ourselves about homeless services in our community, and also educating homeless partners on VAWA and FIPSA funding requirements. When we're a part of coordinated entry and our continuums of care, we're learning a lot about their terminology and funding, and it's an opportunity for us as victim service providers to educate our partners on our different funding streams, our confidentiality requirements, and yeah, the unique needs and kind of the way our systems are designed. We can also assist with developing screening tools and assessments and referral processes. So as Abby mentioned, you know, there's different subpopulations that can have different coordinated entry points of entry. So it's really critical for those different populations to have access to resources, and when creating coordinated entry, screening, referrals, and processes, when we're there and we're part of the coordinated entry process, we can really make those assessments and tools and processes survivor-centered, trauma-informed, and that can benefit all populations. And with those tools, we can develop criteria that includes vulnerability and priorities for domestic and sexual violence survivors. So we've seen many communities that we work with that have extra points for survivors that are in danger or are fleeing as a result of domestic violence. So that's something that would prioritize them within the housing system to get access to resources. So being a part of that and the coordinated entry really gives us that opportunity. And then lastly, we want to be doing this because it's part of the HUD NOFA scoring, and communities want to do well and score well so they can bring resources into their community, and it's a requirement to receive COC funding. While Abby mentioned there's not like we're not all going to turn into a pumpkin at midnight in January, it's really important that we're thinking about these and moving forward with it, because it benefits our communities to think as systems and to work as a system. So yes, it is a HUD requirement and something that will be looked at in future NOFA scoring processes. So I wanted to show a little coordinated entry model overview. This is on the HUD website. So this just is a visual of what coordinated entry looks like. It's very nice and neat. In practice, it's a little bit messier, but this kind of gives you a visual to think about what it would look like. So really, it's a shift from putting the onus on the individual. Like prior, back in the day when I was working in shelter and programs, there was someone would call on a hotline and say, I need a shelter bed or I need housing. You say, okay, great, we're full, sorry, here's a list of numbers. So good luck, call them, and hopefully you'll find housing. So really we're doing a shift and thinking in systems level of shifting it from the onus being on the individual. Survivor, in terms of accessing housing, trying to find housing, where the system is taking onus by coordinating it and having a model where if someone's calling us and saying we need shelter or housing, we're saying, okay, we're full now, but let's do a screening, let's do an assessment, and let's see what resources we have, and let's work with our partners, our victim service providers, our homeless providers across our community and see what we have access to and get you screened in to our services and access to those services. So it's much more beneficial and more trauma-informed in that regard, that the onus is on us as the professionals and the gatekeepers to housing, and really screening people in and doing that legwork to connect them to resources. So let's talk a little bit more about what does coordinated entry look like on the ground, and what are different models of coordinated entry. So coordinated entry can look like a number of different ways. There's not a prescribed, like, this is how you do it and this is the best way ever, because many communities and jurisdictions have very different ways of providing services, and so there's flexibility in how coordinated entry is implemented in communities. So there's coordinated entry points at many different places. There are virtual web-based coordinated entry points, telephone hotlines like 211, or physical in place like a drop-in center or an outreach center, or a one-stop shop where some people might come to get an assessment or referral, but it can be a number of different ways that people access and get assessed for services and assistance. So by creating unique access points and assessment protocols for survivors, it just helps remove barriers and increases access to housing options. So whether or not a survivor seeks housing services at a victim service provider, a survivor-specific access point, or an access point for the homeless general population, it's important that they have equal access to the appropriate housing and housing options and related support services. And victim service providers can work in partnership with continuums of care to determine the best excuse me, that was not me. So someone can mute their line. So domestic and sexual violence providers can work in partnership with COCs to determine the best coordinated entry approach for their communities and advocate for survivors' access to the array of housing options that they need. So if we could go to the next slide, we can look at the different coordinated entry models that I described. There's centralized coordinated entry models, so it's one location or entry point of access for individuals and families to receive homelessness and housing services. There's multi-location, hub or hybrid location, where there's several coordinated entry sites. Some communities have it where all housing providers and shelter providers are doing coordinated entry and doing assessment at their location, and then there's a coordination kind of where the data and information goes to track that. And of course with survivors, that happens confidentially without any personally identifying information being shared. There's also virtual or online screening tools. There's the no wrong door approach, decentralized, where every provider in the community, I described that with the multi-location a little bit, every provider in the community are trained and conduct the same assessment process without deviation or special access. And then there's also innovative models where there's specialized teams of housing specialists where people are going out to the community and doing mobile advocacy and going out into different community spaces where people, they can screen and find people and screen people into housing. So there's a few different models and options to think about. And then I think it's important to note that there are coordinated entry participation requirements. If you are receiving HUD funding through the Continuum of Care, the HUD calls for the full participation of CSE and ESG funded victim service providers to participate in coordinated entry through either an integrated coordinated entry process where victim service providers participate in the broader coordinated entry process, or a parallel victim service provider specific process designed and operated by victim service providers. Next slide, please. So yeah, there's not a one-size-fits-all for all communities. It can be an integrated or parallel coordinated entry process. It may be appropriate, though not required, for communities to establish a comparable coordinated entry process, including different access points and screening assessment tools for victims. And some considerations for folks to think about for a separate coordinated entry process for survivors include developing it in coordination with victim service providers, getting key stakeholders and organizations at the table to be a part of that process, adhere to the same requirements as the broader coordinated entry processes that are being designed, and design according to the qualities outlined in the HUD Coordinated Entry Notice, with the difference being that it's targeted to individuals and families that are fleeing domestic and sexual violence. Some considerations for establishing a parallel coordinated entry process include a comparable victim service provider process can provide survivors with safe and separate access points designed to specifically address their needs, and they can also manage their program's assessment and intake via the homeless coordinated entry, and they can also help survivors obtain assistance through the homeless service system, and the parallel system can have one point of entry or several. So it's very important that if you are considering or designing a parallel coordinated entry process, that if there's still access or you're doing policies and thinking about ways that victims can still have access or be referred or cross-referred over to the homeless system, so they're still having access to the mainstream homeless service system. And we do have examples as well of different models and promising practices in the field of both integrated and parallel coordinated entry processes that we are hearing that work quite well. So we have examples of that and can assist with sharing that information with you as well as part of our DV Housing Consortium training. So I will pass it on to Larissa at NASH to go next.
Thanks, Debbie. So I just want to continue on here and just add something else. I got control of the slides, whomever is. Hold on one second. I just want to add something to what Debbie mentioned, and that is that we know there are many questions coming in around assessment. There are a small handful of communities that we know of that have a coordinated entry DV parallel system. There are a couple of models that are out there, and we are happy to provide some more information about those models. It looks like a couple of you are actually participating in this webinar. So thank you for joining us. Now I'm going to continue talking about what needs to be addressed by coordinated entry systems. So survivors should be able to access the full range of housing and services. This is really important. Something that we have heard is that essentially survivors will come in through whatever the homeless system's coordinated entry point is, and they will be referred out to a domestic violence program, and that may be the end of their journey through the homeless system's coordinated entry process, and that should not be the case. And so we know that there are certainly COCs that do not have a high engagement, or for some, any engagement from domestic violence and sexual assault organizations. And that's something that, as we go through, and you'll hear some repetition through our presentation around this, we want to make sure is remedied in a range of different ways. And so I just wanted to highlight this note that if a survivor comes in through the homeless system's coordinated entry process, that the end game is not necessarily referring that survivor to a domestic violence program. And it might be if the survivor is interested in that, but it might not be, depending on what the survivor is interested in. And so what's really important here is to make sure that staff is trained. Coordinated entry staff and COC staff are trained on domestic violence and sexual assault issues. And be at the table, the discussion and the planning around coordinated entry. Extremely important. And I'm going to go into a couple of ideas and strategies that we have. So key strategies to helping address the needs of survivors including those that are not victim service providers that are part of HUD's ESG or COC program. Okay, we know that many of you are not, but that does not mean that you can't develop relationships with your COCs. And so here are some ideas. Attend COC meetings. So you have to identify who the COC is and figure out where their meetings are. But hopefully some of you are able to do that and make that first step if you're not beyond that already. Become familiar with how COCs operate and what HUD asks the COC coordinated entry process to do for survivors. Being on this webinar today is a step in that direction. Joining COC work groups and providing feedback and guidance whenever possible. So I just want to reiterate, even if you are not funded through your COC, you have a place at the table because we know that survivors go through the homeless systems coordinated entry process. Local COCs are required to address the need of survivors in the coordinated entry process. I know this is reiterating again. DV and SA service providers are in the best position to inform those in the COC. And this is just a reiteration of what I mentioned a minute ago about participating and the ways that you can participate. For those of you that are finding it difficult, and we've heard from many of you that you are, you may not be invited to the table. You may be at the table, but maybe you're not being heard. You might be the only one at the table. Some of the other programs in your community may not have an interest or capacity to be part of this conversation around coordinated entry. And so what we say to you is keep persisting and also point to the HUD guidance in this area when you feel like you're not being heard or if you're not able to, if you haven't been invited or you haven't been able to participate because there's been some exclusion. We hope that is changing, and we do hear from many of you that that is changing. So at the minimum, the coordinated entry process for survivors, whether it's integrated or parallel, it must be built on shared tools and standards and not reliant upon shared databases or other structures that inherently expose survivors to unnecessary dangers. We will be talking about, I know a couple of you were chatting about this, we'll talk a bit about data collection after my section. So again, at a minimum, meaningful and significant involvement from DV service providers in the design and implementation. There's a lot of opportunity now for that, and proactively addressing safety and privacy concerns for survivors. Adhering to confidentiality and safety policies with regard to record keeping or sharing and physical location. I want to do a plug. There was a question and several questions in the chat box around safety policies for COCs and homeless organizations specific to domestic violence and sexual assault survivors. NASH has been in the process of developing a safety planning toolkit for homeless and housing organizations. And we hope to be getting that out to the field in early 2018. It'll be available on safehousingpartnerships.org. And essentially we include model best practices there that I think will be helpful to many of you all as you navigate this in your communities. So again, at a minimum, allow direct immediate access to safe housing for survivors by including a question at the beginning of the interview that allows clients to safely disclose danger, fear, and be referred to the appropriate victim service provider if the survivor would like that. Given the opportunity for survivors to opt out of sharing their information in HMIS due to confidentiality and safety issues. And in your CE advocacy, if you're DV and SA service providers, utilizing that language from HUD's coordinated entry notice that describes the key principles may be really helpful. Safety planning, person-centered services, fair and equal access, emergency services, and inclusivity. And then, let's see, I want to make sure we're not repetitive and watch the time so that we have time for question and answer. Tips for informing the development of coordinated entry to getting housing support for survivors. So learn how the COC and CE process works so that you can better educate survivors and advocate for survivors, and provide training for the COC and homeless service providers on DV 101 and other areas that are needed. I want to add that many of you participated in our National Safe Housing Needs Assessment, and we were able to identify some key areas nationally in terms of needs for training and cross-training, but we were pleased to see that in many of your communities you are doing this. So if you're not doing it, we're happy to talk more about how to make that happen, but we certainly support it. It's extremely important to have staff trained, both DVSA staff around the homeless and housing system, COC, coordinated entry, and vice versa around domestic violence, sexual assault dynamics, and how the DV system works in your community. Additional tips for informing the development of the coordinated entry process to get housing support for survivors. Ensure special consideration and application of trauma-informed assessment tools and techniques. I believe we have a couple of questions already from the chat box that we'll get to some of this in our Q&A a little bit deeper than this. Develop protocols for referrals of survivors both to and from the homeless system. Something that some communities are doing that we really want to promote as a best practice is co-located staff. Having co-located staff in your coordinated entry process, if that's something that's feasible, is something that works really well in several of the communities that are doing it, to provide that additional and direct support to survivors who are trying to access services. And again, I'm just going to echo here, engaging in cross-training. Here, I jumped ahead with my co-located staff. I see, well, here it is again. I'm going to plug it again, co-located staff. Advocates attending, attendance at the coordinated entry intakes if possible. DVSA service providers serving as a point of entry for coordinated entry intakes and provide aggregate data and vulnerability scores for prioritization. Ongoing training. Now I'm a broken record, but I hope you all hear us loudly. Ongoing training, cross-training around these issues to the staff that are working on it. And some of this is a bit repetitive. I'm actually going to move ahead just a little bit, and I'm going to pass it over to Emily from Collaborative Solutions, who's going to dive even deeper into some of your questions around the collection of personal information and what that means and what we do and what happens from there. So Emily, passing it off to you.
Can you hear me?
Yes, we can hear you.
Okay, great. Thank you so much. So hi, yes, thank you, Larissa. I am Emily Reamer, and I'm with Collaborative Solutions, which is based in the Southeast in Birmingham, Alabama, but we do provide national HUD-assisted technical assistance and training. Our focus area is highly vulnerable populations, and we all know that survivors fall under that umbrella due to safety concerns. Abby mentioned earlier around, coordinated entry is a systemic change to address broader systems of the community. And so while the guidance is set and we need to follow it, we also know that we need to be creative in order to meet the needs of the survivors that are specific to that community. So this slide a little bit about what that prioritization can look like, especially when the survivor chooses not to or is unable to consent related to information being shared. So some options communities have related to that creativity that's allowed. Factors that they may combine to assess that prioritization can be related to challenges, physical, mental health, anything defined as a disability. Anyone that needs a high level of supportive services or is using high utilization of crisis services, is unsheltered, vulnerability to illness or death. So any of these factors that are specific to the community, you have an opportunity to not only identify what they are, but then decide which are a higher factor that can prioritize, and communities do have the option to choose that being a survivor is one of those vulnerability factors. I also want to talk a little bit about assessment. We can move along to, there we go. So assessment is, there was a long-term history of believing that it was a myth, really, to think that we needed to use one assessment. So we're really trying to push in the field that there's an opportunity here to meet the needs of those that are most vulnerable with limited resources and ensuring that those services and resources meet that survivor's needs. So we know that the supply of housing stock and the housing stock that is safe and secure does not meet the need of our populations that we are working with. And so therefore we need to figure out, as Larissa mentioned earlier, how to be involved in that process. And so obviously being at the table that was referenced earlier, being involved in those decisions, helping your community understand what the needs are that are specific to survivors, encouraging training. So again, like Larissa said, for those completing the assessment, we need to help them understand how to implement this in a trauma-informed way. While safety concerns during assessment are a priority for all of those populations we're working with, specific to survivors is the fear and danger experiences of abuse that make it particularly sensitive to assure that these assessments address safety concerns and help direct survivors to access those services immediately. Emphasis is on the immediate addressing that because a threat of danger may be posed, and that is specific to the survivor. So trauma-informed. So we know that trauma-informed is a best practice for all individuals during all activities of our engagement. We also know that the coordinated entry assessment process could potentially be further traumatizing, and we need to incorporate our training with those assessing individuals to make sure that that process does not trigger additional trauma. And so this can look a variety of ways. It should inform the person right up front about how the information will be used. It must allow them the option, so it needs to be survivor-driven so that they can refuse to answer questions or choose to not disclose personal information. I think we can move along. The protocols, we've talked a lot about what needs to be done, and what we're really getting into is how to make this happen. And I'm aware of all of these great questions coming in, and so I know we want to spend some time. But as we move through, we want to think about what the process looks like. So, is a physical location, being sensitive around that, thinking creatively around virtual options. We want to be able to provide immediate access to both housing and in the other direction, right? So this is a mutual relationship wherein referrals going to victim service providers and housing providers, that all parties facilitating that assessment are very aware of what services are available to that survivor. We want to make sure that that communication is clear and that individuals have the opportunity to have the space to determine what is best to meet their needs in a safe way. So we move on to, determining when are the needs best addressed by a victim service provider. We know that several communities might have separate coordinated entry processes, and we want to, again, provide a survivor-driven opportunity to make that choice about what they want to pursue. Let's see. There are a lot of complex dynamics. I'm paying too much attention to all of your great questions. There are a lot of complex dynamics around privacy, safety planning, confidentiality, managing a crisis at an access point, being able to do that, to think through how do you not only make the referral but complete the referral. So helping individuals get to where they need to get in a safe way, because, again, specific to this subpopulation is that a life-threatening condition may be at hand. So I believe I'd like to, thank you, Larissa. The confidentiality, again, practice for all individuals, but it is especially sensitive for survivors because of this immediate threat of danger. I believe Abby mentioned earlier about data drives decisions, and we all know that those decisions can often be connected to the funding and resources that allow us to continue to provide services. So, however, the challenge that many of you are aware of based on your questions is that DV programs are prohibited to enter private information related to their survivors. So other options exist, and what is crucial here is that the COCs, the victim service providers, and the survivor themselves are all working together to identify how to do that in the most safe way. I'm looking over on my note. I'm trying to see if I can address anything. This resources, we've had plugs along the way, but I would really encourage that you take advantage of the guidance that does exist out there related, especially the Coordinated Entry Guidebook has some critical information. And earlier when we were opening up, Larissa talked about the Safe Housing Partnership, which also provides quite a bit of resources. I think I should, in the interest of all of these great comments coming in, that we should move into questions. We're very thrilled to have the opportunity of having Britt join us from USICH and Abby from HUD because we know that this process of coordination is complex and evolving, and while we want to standardize when we can, we also want to be as individual as we can. So we'd like to take some time to dedicate to that discussion.
Emily, thank you so much. So this is Larissa. I'm going to close us out, and then we're going to shift into that Q&A that I know Emily mentioned we are eager to do, and I know many of you are as well. The resources that we have on this page right now are also included in that FAQ. As Emily mentioned, we've highlighted all of them several times throughout the webinar. I'm going to skip back to that in a second. We will be sharing a PDF of the webinar today with all of our contact information. If that gets lost in your email, if at some point you have a question, which you will, and you're like, who do I contact? Go to safehousingpartnerships.org. There's a way for you to shoot a request out. It will go to the 4 technical assistance providers, and we will figure out who's best to respond to you. So if you lose this, if you forget this, if you forget our contact information, that's the route to take. In the meantime, here's our contact information. And I'm going to go back now to the beautiful questions slide, and I'm going to pass this over to Christy with the National Resource Center to facilitate a Q&A for the last about 20 minutes, I believe we have. So thanks so much, everyone, and we look forward to the questions. Christy.
Hear me now?
Yes, we can hear you.
Okay.
Sorry, I did not mute, and I was like, what happened to me? Okay, we have had a lot of great questions in the chat box, y'all, and I appreciate the folks that are on the call that have been offering up some great resources to each other, and that's been wonderful. So to start, Grace asked, do you have any model confidentiality/safety protocols that COCs can use to develop theirs, including elements to look for, including responding to subpoenas, et cetera? And I know we answered that in the chat, but I just wanted to be sure everyone had that answer. And Larissa, was that the question you had answered for Grace?
Yes, and sort of. So in terms of the safety toolkit that NASH is going to be releasing, that's going to be a great source for safety policies and planning to consider, and best practices and models. In terms of the subpoena question, regarding, I think more specifically that was regarding whether or not VI, and I'm not sure it came from Grace or maybe it did, I don't know, whether or not the VI SPDAT could be subpoenaed and whether or not that information would be shared. I gave a quick and dirty answer, which essentially is that, well, anything can be subpoenaed. As to whether that information can be shared as a different question. It's a little bit complicated in that it's also connected to local or state privilege protection. So what kind of communication, and that extends across the board, is able to be shared and accessed in a court proceeding. We provided a resource in the chat box that I think we're happy to send out again. I think if there are more specific questions around this, it's better to take offline because we could have a very extensive conversation about this, and I don't want to take up our time with that. So if you have specific questions, feel free to shoot an email to me or safehousingpartnerships.org, and we're happy to dive deeper. Thanks, Christy.
No, thank you. So Meadow asked a great question that really sparked some great interaction between folks. So everybody get ready. This is a multi-part question. So Meadow asked, is there a particular assessment tool that communities have been using for DV folks? And Meadow, we appreciate that question. There was some additional follow-up that where one community is using the SPDAT tool, which tends to give preference to chronically homeless, and another community that said that they're moving towards using a housing instability index that has the Campbell Danger Assessment as part of the assessment tool. So team, would y'all like to kind of take that in multiple parts and talk to everyone about that? Everybody's being very quiet now.
Well,
this is Debbie. I can jump.
Go ahead, Debbie. Go ahead. Yeah.
I was just going to jump in really quick, and I don't have a specific answer, but we are working on a document on the danger assessment used as a housing screening tool, and that's something that is in the works that we are pulling together as part of the DV Housing Consortium that will address that. And I can say that the tool by design was not designed as a housing screening tool, but we have been hearing a lot of feedback that people are using that. But Larissa, go ahead with other points as well.
Thanks so much, Debbie. I just wanted to add to what Debbie said that there are some issues with using lethality questions as part of a housing assessment. And, you know, as our technical assistance team is sorting through that and considering implications, we want to flag for you that there are other ways and other models to use that do not include lethality questions. We really are concerned that that is, first of all, not the best way to assess for housing, and second of all, there's a level of training that needs to be acquired to do that. And again, just flags around whether that is the best course of action when assessing for housing needs for domestic violence and sexual assault survivors. So we'll be providing some more guidance and information to all of you. If you're looking for, and I said this before, but in case it got lost, there are a couple of innovative models out there, a handful,
that get to some of these questions and assessments that we are happy to provide you all with information on. So again, safehousingpartnerships.org for that. And I'm going to pass it over to Abby now to talk a little bit more and answer another part of this question.
Larissa, can you confirm that you can hear me?
Yep, yes. I can hear you.
Okay, great. Thank you. I always get nervous that I'm speaking into the ether. So I wanted to speak to the something that I think is kind of underlying the question. At least it's a frustration that I've heard a lot on the COC ESG funded side of this, which is that people feel like they are using an assessment tool that drives their prioritization rather than having taken the time to establish a prioritization process that their assessment tool then supports. So I want to give a little bit of nuance there. I think it's, as a field, even just a couple years ago, we had a problem on the strictly, so not speaking for the DVSA providers, but for homeless service providers, generally we had a problem with people wanting to serve those who were the easiest to serve. And so we have really pushed for this notion that, no, you should be serving the people who most need it, not the people who are most likely to be successful. And in doing that, the assessment tool that has gotten picked up a lot is the VI SPDAT. There are other assessment tools, but I can see just from the chat box that a lot of you all are using that. And the reason is simply people didn't develop others, or some people developed others, but they just didn't get the play that VI SPDAT did. I am not here to say anything about any assessment tools, but rather to focus on the process that I think needs to take place now, where a lot of communities have picked up an assessment tool. And I think it's a good thing to focus on the people who are hardest to serve, and I think that the tool has done that. But I think now there's a moment to get more nuanced and go back and take a look at if there are parts that need to be modified, if there are questions that you want to get rid of, if there are things like, I know a lot of people feel that the assessment tools in play right now are re-traumatizing. And understanding that, figuring out what modifications would look like, or like in the case that I saw with Maria in Multnomah County, that they've developed their own. I'm sorry, my dog is chewing a squeaky toy. Hopefully you can't hear that. But that is, I think, what we need to get to now, that there is a common understanding across the community or across the continuum on what vulnerability or what most severe need means to the community, whether you want to define a specific set of vulnerabilities and service needs for people fleeing violence, and then make sure that the assessment tool that you're using fully supports arriving at that prioritization, rather than sort of like putting you in a weird gray space where the assessment isn't feeding into an ability to prioritize.
Great, Abby, thanks. Does anyone else from the team want to add anything? Okay, good deal. So this is kind of another multi-part question, but very relevant. How do DV programs deal with requirements to participate in HMIS? How do programs address COCs who do not see DV as a priority, especially compared to SMI, severe and persistent mental illness population? And then if y'all can hold on that, let me just add that Rebecca says she's a little confused because on one hand, VAWA prohibits DV providers using HMIS, and now we on the call have been talking about sending clients to the COC to participate in coordinated entry. So team, can y'all offer up some great wisdom for those questions? This is Larissa. I'm happy to chime into a part of that. That is that Nothing has changed in terms of our messaging, and I hope it wasn't confusing, around personally identifying information and the federal laws and some state and local laws that absolutely restrict that sharing. So nothing has changed in terms of our message. But the reality is that survivors do go through the homeless system for programs and services. And oftentimes, they are not made aware of what their rights are in terms of not sharing that information. And also, oftentimes, we have programs that aren't aware of what the laws are and what that means in terms of having that information entered. And more importantly, of course, that it's a very serious safety issue for survivors when certain information is potentially able to be accessed by others. And so I just want to share that nothing has changed in terms of our messaging. There are federal laws, some state and local laws that absolutely restrict entering this kind of personally identifying information. However, what we're trying to get across, and this is extremely important, is that survivors use the various systems for services. And what's important here is that survivors are aware of what their rights are so that they can continue to use the systems and access housing, especially the homeless system. Sometimes that's one of the only ways to get rapid rehousing, for instance, or other services. So we don't want to restrict access. What we want to do is make sure that folks are abiding by the laws, but also serving survivors, are educated about what the laws are, that survivors know what their protections are, and know that they can opt out. They do not have to share information, and that does not mean that they will not have access to services or housing. So I just want to reiterate that message. I don't know if anyone, and I think I speak to most of what that question was. I don't know if anyone else has anything to add.
Yeah, this is Abby again. I would love to add a bit to that and respond to a few of the points of confusion that I see people writing into the chat box. It is so helpful to see those articulations. So specifically, I'm seeing one that is asking, okay, so as DV/SA providers, we're not allowed to use HMIS, but now you're asking us to be part of a coordinated entry process that is tied to HMIS. And of course you can hear my dog going nuts again, I'm sure, in the background. My apologies. So what we're trying to parse through right now, and what we'll be able to provide some guidance on to the field fairly soon, is what it looks like to get a referral to the, I guess what I would call the mainstream homeless coordinated entry from the DV/SA providers in a way that does not violate VAWA and does not put survivors' privacy and safety and confidentiality at risk, but also gets them access to housing. That is not an easy line or an easy, what's the word, needle to thread, but we are all working on it. I'm working on it with all of the partners who are on today, including OVW and FIPSA, to be able to get clearer on that, because that is not an easy, it's not an easy place to figure out. But the other thing that I will say is that the prohibition against entering into HMIS is a hard line and excludes anything that isn't de-identified aggregate. So I'm seeing some about anonymous entry, and I would love to follow up on that separately, but just say that from our perspective, anonymous entry isn't something that we would support doing. So I want to figure out what's going on and just help get there on that. But I did want to flag that.
And this is Debbie. I also wanted to make a note that this is a reminder, and this webinar has been so helpful, that we are in the planning stages around a comparable database and HMIS coordinated entry requirements webinar in the near future, in the coming year, but it's definitely come to our attention with the chat discussion that we need to prioritize this, so thank you.
Great. Any of the team, any other comments before we move on to another question? So this is kind of in conjunction with the discussion we've already had. Are there any DV centers that are administering the VI SPDAT? And if so, what do they do with it upon completion? And this is coming from Melissa. Melissa, you have stumped our panel today. Or everybody's being shy.
Well, this is Debbie. I can chime in really quick that there's no requirement that I'm aware of, and Abby, please chime in that there is a need in the file. I know in the programs and HUD programs there's a lot of HUD file requirements, but there is no requirement to keep the VI SPDAT. And it's actually, in terms of the discussion around subpoenas, it's actually would be best practice, I would think, for our field you can do the VI SPDAT and get the score if you're using it, and then that's what is needed in order to prioritize and qualify for housing services. So there's no need, as far as I'm aware, to keep the VI SPDAT, the form, in any client file for a DV survivor working with a victim service provider.
Hey, Debbie, it's Abby again. I'm sorry I didn't chime in there quickly enough, but I would second what you're saying. I want to go through a couple things and just make sure that I'm really clear about them. The first is that standardized assessment tools, any tool that is a standardized assessment tool, there is a requirement, if you look at the coordinated entry notice, to use a standardized assessment. We are completely agnostic on what that assessment looks like, other than making sure, like I said before, that it feeds and supports your prioritization policy. So I would encourage you to internalize it, take that feedback, or take that statement. I'm making that statement across all of the webinars and all of the engagements that we are doing right now around coordinated entry. But I want to be really clear about that. So there's no single assessment tool that is required. There is a requirement to have a standardized assessment process. And that just means that everybody who fits into one of those population characteristics that I went through before, that everybody that within that is getting assessed in a standardized, similar fashion. And again, this is all to remove the barriers that have been in place to people who are more likely to be successful getting served first. But to go back to this specific question about what you do when you have completed an assessment, in this case you're asking about the VI SPDAT, but I'll make it general and say any assessment. I would say from our perspective, wanting to prioritize the safety and confidentiality of people, if you are in possession of information that could be subpoenaed, we would not support you keeping that in a place or in a manner in which it could be subpoenaed. That, to me and to our office, constitutes a pretty high risk to somebody's confidentiality and safety. And I think I saw somebody earlier type into the chat box about needing to know what the HMIS lead or the COC's policies are, their privacy policies. So every continuum of care has to keep a privacy policy associated with their data. So anything that would go into the HMIS is governed by a use and disclosure policy. So it is good to know what that is, and it's also good to have your own, and to know what your state privacy laws are, and how that impacts whether information could be subpoenaed or not. The one other consideration I would put into this is, so we're really also pushing with this coordinated entry process, and I think somebody may be off mute, but with this coordinated entry process, it's really important to minimize the number of times that you have to have discussions with people that could potentially be re-traumatizing. That is actually in conflict, though, with protecting information and having very, very limited sharing, even within an agency. So I think that's, again, I'm just raising considerations for you. We don't have any like black and white answers here, but that kind of sits in tension, and it's important to figure out for your community where you are with that. So if you're getting rid of assessment tool like granular information, but there may be certain things that would help with referrals later, I think it's really important to think through that. Again, I don't have responses or hard and fast answers for you today.
Thanks, Abby. So I want to be mindful of time, and we're about to hand off to Larissa so she can bring us on home. But I know we didn't have a chance to get to everyone's questions today, but we have captured all of the interaction in the chat box, and we'll be following that. But you also know, you see the safehousingpartnerships.org website popped up on the screen now, so you can certainly reach out to us after, and Larissa may be reiterating that, but just to let y'all know, we will be touching base. Larissa? Thanks so much, Christy. So I want to say this because I see the chat box. We all hear you. We understand that there are so many questions. And I want to say that it's sort of weird to say this is the beginning, because I know that many of you have been receiving support around this. But we are here really focusing on this specific issue. This is one of the reasons around why the Domestic Violence and Housing Technical Assistance Consortium was formed. We are bridging the worlds, and we are here to work with you. And we know that some of you are so frustrated, and we know that there's confusion, which is also why we are grateful today to have HUD and usage on this webinar, so you can hear directly from them what needs to be happening, and what their thoughts are around some of these complicated issues. So I also want to just reiterate that if your community is struggling with this, if you have specific questions, you can get direct technical assistance from us. We'll set up a time to chat and talk and work through some of this, and it can be more than one time. So we are here for you. We are here to support you in your process. We are here to work through some of this. We are here to develop more materials and get more practices out to the field. And we just want to thank you all for working through this. We know that it is a lot. So we want to support you to the best of our ability. We will have an evaluation link, I believe, at the end of this webinar, and also that might be sent out after. We'd love to hear your thoughts. And also, thank you for dealing with our tech issues on this Friday. We're sorry about some of the bumps in the road, but hope that you were able to get some of what you needed from this webinar. We look forward to hearing from you all. safehousingpartnerships.org, or contact us individually. Thanks, everyone. Hope you have a fantastic Friday and a great weekend.
The leader has disconnected. The conference will be terminated in 5 minutes.